Every October, the world turns pink. But for many African women, the story of breast cancer is not just ribbons and campaigns. It's about silence, late detection, and lives cut short. Across the continent, stigma and poor access to healthcare still keep too many from getting the help that they need. Yet, survivor voices, advocacy, and new tools are rewriting the script. So what does it take to change the narrative on breast cancer in Africa? Welcome to Fafanua Afrika. This is a show where we spotlight the youths, their challenges, and their opportunities across the African continent. And of course, it's another episode, so sit tight and relax, grab a cup of coffee as we take you through 1 hour of blissful conversation. My name is Blessings Mosugu, and I'll be your host. In case you didn't know this, breast cancer is the most common cancer among African women. Yet, myths, fear, and poor access to screening continue to fuel late-stage diagnosis. But change is happening through community action, digital advocacy, survivor stories, and new healthcare approaches. Today we ask, how do we break the silence, empower early detection, and turn awareness into real impact? But it's not about to be a monologue. As always, we have amazing persons who will be joining us for the conversation. But we're going to be starting with one of our delectable guests, and that is Oluwatobiloba Oguntoyinbo. She is a cancer patient advocate and co-founder, Saint Cancer Initiative. Thank you so much, Oluwatobiloba, for joining us.
I'm happy to be here this afternoon.
All right, it's an absolute pleasure to have you join us as well. So, Tobiloba, I'm just going to start by asking, how widespread would you say that breast cancer is in Africa?
I'm going to be using Nigeria as a template, as a sample, because that's the largest country in Africa. And when it comes to breast cancer affects mostly women, even though men are affected. It has the highest incidence rate compared to other type of cancer. Following it is cervical. It has approximately 40.5%. That is a very high number. If annually cancer occurs for like 32,000 new incidence cases, and out of those 32,000, about 15 to 16,000 is breast cancer. So it's actually a lot, and it is widespread, not only in Nigeria, but across Africa in general.
Oluwatobiloba. We also have joining us Gloria Orji-Nwajiogu, the President, CEO, Network of People Impacted by Cancer in Nigeria. Gloria, thank you for joining us as well, if you can hear me.
Yeah, thanks for having me.
An absolute pleasure. All right, we still have these amazing ladies with us, but in the meantime, we conducted a vox pop asking Nigerians about breast cancer. Let's take a listen to what they have to say. All right, in the meantime, while we wait to get the vox pop, let me just come to Gloria now. Oluwatobiloba has explained how widespread she believes breast cancer is across Africa. I think that another point to note is also how very undetected these cases still go. So let me throw that question at you, Gloria. Why do you think that so many cases still go undetected until late stages, considering how widespread it is in this part of the world?
Okay, thank you so much for the question. I think the major issue is that we are yet to be breast cancer aware. A lot of people still believe in so many myths, and some religious group doesn't even help us either. You know, we bring up issues like it's a curse. Some people believe that it's because you sinned, and some people believe that it's a kind of a taboo that you probably had. You know, there are cases whereby they said, oh, if you were unfaithful in your marriage, definitely you're going to have such as the repercussion for your deeds, you know. So the point is that the awareness is out there that there are so many people having breast cancer, but the reason for having the breast cancer is something that we should talk more about, which I think is lacking, you know. People attribute it to so many things than what it really is. I think that's why it's widespread.
All right, thank you so much, Gloria, for that. Okay, so it's time to take a look at the Vox Pop now. We did ask people about breast cancer and what they thought, and we want to take a listen, and we'll build the conversation on that.
I hardly go to because I feel like I'm fine and there's nothing wrong with me, apparently.
Okay, I run an annual checkup, but aside that, when I have slight issue with my head, I of course visit the hospital. Last time I had a breast checkup was 2 years ago, but I would not advise every other person to be like me.
The last time I did a checkup, I think that's 2 years ago.
Yeah, I don't joke with my health, so my checkup mostly is every month. Every last Thursday of the month, I go for medical checkup.
I know that I've seen that goes to a certain stage. The cut off your breasts. At least that's what I know.
Well, I know breast cancer is a lump that gets to develop over time in a female's breast. But then when it begins to develop, the signs or the symptoms are not very significant. So it's advised that we visit the hospital often for mammography and other health-related conditions.
Yes, I think I felt to be a victim of it. My wife's sister, so I don't joke with that. So then I thought it's, you know, we just believe, oh, it's a village thing, people are after you. But when I discovered this lady, she's a believer and faithful servant, and she felt to be a victim of it. I don't joke with it.
I can't do much, but the little I can, I think creating videos and posting online on teaching. For example, now you don't even need to go to hospital all the time to check up. I saw this stuff online. For you to check your breast, you raise it up like this, you turn it like this to check like if it's the same thing, and you feel your breast daily to check if there's any unusual lump. So I believe I can create a video for that to teach young girls. And also going to schools too will help, because they are the younger generation. Their mom might be at home with breast cancer already that they don't know. But once the child goes home and be like, Mommy, I learned this today at school, this, the woman might be urged to go to the doctor. She'll be like, I have this lump in my breast, but I did not think much about it to grab. So I think that's what I can assist with.
Very to get involved, I will start with students in the primary school. That they are like at my own age. When I was at the age of 9, I was already going breast already. So no one told me anything about what to care for and what not to care for till I got to my junior secondary school, and then I heard of a situation of a girl who had cancer, and I was like, why would someone so young have cancer of the breast?
I work with various organizations that is health-centered. We raise awareness against breast cancer among women.
I encourage every woman, most especially I start with my wife, every 3 months, this is how I push her for scan, go and check, we go for checkup and the rest of them. Yes, not only to my wife, even to my siblings, I extend it. So you calling my attention today, I feel it is time for me to even move to the society, let people know how dangerous breast cancer is and how it can be prevented at early stage.
Of course. Not be woman born you. You're going to suck your future child. Okay, sorry. Your future wife can be diagnosed with cancer. How will she feed your baby? How will she breastfeed your baby? And breast milk is the best than all those nan stuff like that. So, of course, men should also help. Without us, how do you want to...
Advice to men out there is breast cancer is not just female based, or it's not the sole responsibility of female to raise awareness against breast cancer. So everyone should be involved, both male, both female, because it affects the society at large, not just one person.
I feel every woman out there has a right to learn new things. There are some people who don't have awareness about it. Like, I would say market women, for example. I mean, not all of them have the chance to go to school. If it is their son who went to school and just come back, and Mommy, they taught us this. a boy is aware like that. And as a husband, I would advise you at least know one or two things about all these things about females, not only breast cancer. I mean, we have gonorrhea disease and all of that.
Whatsoever that touches the head touches the body. So I want to encourage every man, whatsoever that happens to your wife, your sister, your mother, or your cousin, indirectly will affect you. So always push them for checkup every 3 months. Let them go for checkup and know how to tackle it.
All right, very profound words there. That was the Vox Pop that was carried out on breast cancer. And it's amazing to know that people are, number one, not completely oblivious about that. And then number two, are actively advocating for not just women to know their bodies, but also for men to be involved and, you know, the society in general. We still have our guest with us, and also we have joining us right now Temitope Okembe, cancer survivor and office administrator. Thank you for joining us, Temitope.
Good afternoon. Thank you for having me.
All right, so Temitope, let me just come to you. Based on the Vox Pop that we've heard, one of the things that, you know, kept recurring was the need for awareness, the need for people to be more aware about this. You know, there's some things that people can do on their own without even having to go all the way to the hospital. So let me just start by asking, how dangerous or detrimental would you say that ignorance is when it comes to breast cancer?
It has to be the most dangerous, because how can you fight what you don't even know? So if you're not even aware of what you're fighting, how then do you want to prepare? How do you want to fight it? So ignorance is the number one killing machine, if I can put it that way, about breast cancer, because a lot of women, like I said, a lot of women don't even know what they're up against. They don't even know how deep the gravity of our not knowing runs. So you can't afford to be ignorant. Everybody needs to know. And awareness shouldn't even stop in October. It should be a continuous thing until every woman is aware and they know what to do, how to do it, when to do it.
So, thank you, Temitope. Now, one of the things that people say a lot about breast cancer is that the breast cancer in itself is not as dangerous as late diagnosis. Would you agree with this?
Partially.
Late diagnosis is the cause of increased mortality rate in breast cancer, just because when cancer is detected earlier, it is easier to treat. It is easier to treat and curb it from spreading to other parts of the body before having to combine so many treatment options available. So for instance, if, for example, someone was diagnosed at a stage 1 or stage 2, it's easier to treat at that point compared to when the cancer has metastasized and has moved to other part of the body. When the cancer is still localized in the breast, we can do chemo and radiation therapy, and that could yield a positive result, an effective one at that. But the moment it's beginning to spread to surrounding tissue and organ, then it becomes complicated. It's complex because what was meant to now be for breast alone has to be repeated for other parts of the body. So if people are aware of what they should look out for, changes they should look out for, then it's easier to get tested on time and easier to catch the cancer cell on time before it actually spread to other part of the body.
All right, thank you so much, Oluwatobiloba, for that. Let me throw the same question back at Temitope. Would you agree that late-stage diagnosis is one of the major challenges when it comes to breast cancer conversations?
Reasons. So late diagnosis is the most dangerous part of breast cancer.
Gloria now. Let's come to Gloria now. Gloria, what would you say are the practical steps that young people and communities can take to identify early signs?
We have the phone with us every time, but what do we look for on our phones? We look for every other thing apart from what is happening in our bodies. And when I go for advocacy visits and creation of awareness, there's something I always say. I tell people, know your body. If you don't know your body, you wouldn't know when things are going wrong. And so I still believe that awareness is the key. If people don't get to know that something is actually wrong with their bodies, then even when something gets wrong, they wouldn't recognize it. And that leads to late detection. And secondly, even when they find out, they may not be able to do much about it. And that's why sometimes we say early detection saves lives. To me, it is early detection and early treatment that saves lives. So getting this out on social media, talking about it, talking about the intricacies that goes with cancer diagnosis, especially breast cancer diagnosis. Unfortunately, most breast cancer diagnoses are not painful. And that is why a lot of people are so comfortable with it. And so if at all we want it to get to the community, we need to translate these key awareness messages in local languages and take it there. I was asking one of the Ministry of Health officials, I said, how come HIV is on the jingles of almost every radio station, both in the city and in the villages? The same thing with tuberculosis, but none is being heard about cancer. And unfortunately, cancer is killing a lot of persons. So I don't know why we are not really doing what we're supposed to do, because these are the things, by the time we keep on sounding it, people will get to know. Now, no one is afraid of HIV anymore, but everyone is still scared of cancer. And so awareness is the key. And the right education should be taught. Like someone mentioned, it shouldn't just be in the high institution or whatever. It should start with the children, because their brains are more open to absorb things that are being told them now, unlike when they grow up and then they have so many distractions.
All right, thank you so much for that, Gloria. Let me come to Oluwatobiloba now. How important are self-examination and regular screening in Africa's fight against breast cancer? One of the people that were interviewed in the Vox Pop did say that there are things that you can even do on your own before you have to go to the hospital, but we don't even, teach the young girls all of that.
And I'm going to start with a story I saw on Instagram not quite long ago. I saw a woman, she was just a mother, she was training her young daughter, like, these are your private parts, don't let anyone touch these areas of your body, which I think is great. And I thought to myself, what if we actually teach our kids how to take a look at their body, how to check for, if something is wrong, if there's a if there's a discoloration, you should let me know. If you feel a lump, you should let me know. Earlier, when you played one of the interview with the people you guys spoke to, she said, breast cancer is a lump. As much as breast cancer can be a lump, that's not a generalized statement. Because I, for one, had a lumpectomy and it wasn't cancer. So cancer is not always a lump. And she also mentioned, I was told that you raise your hands up and then you check for your breast. Yes, you check that. That will let you know if there's a lump in there or if your breast is okay. But are you also looking at the color of your breast? As much as we are dark-skinned and it might look like, I've always seen it will turn red, but I can't see any red or my red color on any part of my breast. That should not stop there. Is there a nipple discharge when you are not breastfeeding? So these are what we should actually be intentional about. Some people don't take a look at their armpits until when they are ready to wax or shave off. What does your armpit area even looks like? So it's not only like focusing on breast and then you ignore the other areas outside of your breast. And as much as we do self-examination at home, someone mentioned, I go for mammography. Mammogram should not be done until you are 40 years old. So that's like a misinformation right there. because the moment someone is being exposed to such rays at a tender age, it affects the body as well. The safer option would be to go for a regular breast ultrasound. But when information is being put out there for people to say, hey, it's not just mammogram. You don't wait until you are 40 years before you start taking proactive actions about your own health. Start from your bathroom. You don't have to do it every day, because we all know every single one of us rush to work at one point or other. So you don't have to do it every day, but be consistent and do your own self-examination regularly and be aware of what exactly you are looking at. Just like Ms. Gloria said earlier, she mentioned how that it's not just you checking breast and that's it. When something seems off, take proactive measure to actually ask yourself, what am I going to talk to? Should I go see a doctor on this? So it's not enough to self-examine. When you self-examine and something is off, take proactive actions immediately.
All right, thank you so much. That was profound, Oluwatobiloba. Let me come back to Temitope now. Let's talk about awareness. In what ways are awareness campaigns, mobile health clinics, and tech tools making a difference between now and, some months or years ago?
Thankfully, now there are informations out there. People are coming up to talk about it. Before, it wasn't like that. Even as at last year, when I was going through my cancer journey and everything, there wasn't that much information, that much that I was privy to, until I was fighting the battle and I was actively looking for information and awareness online. Before I now knew that, oh, there's this group, oh, there's that group, oh, there's this organization, oh, there's this foundation. So a lot still has to be done. And I think for me, the bulk of it will now fall on survivors like me who have actually gone through this thing and have fought the battle and have been victorious to now come out and share stories. Data is one thing, but stories is not relatable. So instead of just throwing out data and statistics, when people see other people that have actually gone through it, that have, been through what they are experiencing, it gives more hope. It keeps them more open-minded to actually want to fight it. And that we were able to demystify it and then fight the stigma that, oh, it's not because of something you did, like that lady was saying earlier. I'm sorry I didn't catch her name. That it's not because you sinned, it's not because you were unfaithful. It wasn't any of that. So people need to actually speak out more about this thing, about this breast cancer, their journey, especially for those of us that have survived it. I think speaking up more will create more awareness and it's more relatable. That way other people draw hope and they have courage to fight it as well.
All right, thank you so much. Gloria, let's talk about myths and fear of public perception. Now, we know as much as we, wear the pink ribbons every October and try to campaign and raise awareness about breast cancer, there's still people who feel there will be stigma attached to it. There are people who feel like they shouldn't have to talk about it, especially the other gender. So how would you say that myths and fear have shaped public perception of breast cancer?
I think we can make the whole noise, because sometimes I call it noise, especially in October. There's so much noise. But the real thing is, does it get back to the basics? And the basics is this. Have people actually accepted that somebody that is working for you that has breast cancer has a chance to live? No. People still believe that you're going to be a burden to their company. And so what do? The next thing is they tactically terminate your appointment. I'm coming from the angle of the stigma. That is why people don't talk. Then you see a woman, she knows she has cancer. Some were even confirmed. Does she talk about it? No. Why? Because probably she's scared that her husband will leave her. She's scared that when she starts going to the hospital, as the breadwinner of her home, her children will suffer. sometimes there's this struggle between choosing between your medications and then taking care of your home. So a lot of things comes to bear, and these are the reasons why a lot of people don't want to come out. It's not because they don't know about breast cancer. It's because going and facing it, it's a huge task on its own. And you could decide not to even bother about it and then let the D-Day come and then everyone goes. So if there are legislation, like now I know that HIV has a legislation that you cannot sack anyone that has HIV because of his status. You can't do that. If not, the company will be prosecuted. But none is being done in terms of cancer. And so a lot of people hide these things, not because they don't know, but because facing it and coming out to talk about it doesn't go well. Some people still believe that, you know, I work as, we in our group, we are over 400 members of our network that are all cancer patients. And one thing that resonates everywhere is that a lot of people don't want to tell people. One, because people see you, that's the ones that probably are self-employed. It's not as if there's a problem there, but the thing is that people see you as a walking corpse. Everybody is kind of expecting when is it going to happen, when the person will give up. You know, that is just it. And so some people don't want to talk about it. Some people, when you even tell them, they start crying more than you. And when they start crying, they keep giving you on this, the kind of advice you hear, the kind of things you hear, you will love to even keep quiet. And so, yes, there's so much noise about it, but does it translate to making the mortality rate from breast cancer to reduce? No. And that is when I believe that more actually needs to be done.
All right, thank you so much for that. Let's take one more question before we go on a short break. Tobiloba, let me come to you. Why do you think it's important to involve men in breast cancer awareness conversations?
In a community like ours, where women, we are still literally gaining our voices back, even at this, unfortunately, even at this time, men need to be involved because every family has a man in their family. And if men can actually have an understanding of the women's body, then it makes it easier for it to be accepted. Because for majority of families, men are the key decision maker. So the moment the man doesn't accept or is unaware of cancer, then, or what is going on with anyone or any woman in their family, then pretty much the woman is doing it alone, or the patient is just trying to fight alone. And also, there's this thinking that, oh, maybe breast cancer only affects females and men are not part, such that even when a man is being diagnosed of breast cancer, they don't want to say it out because they're like, oh, you have breast cancer, you're a woman. Like, they don't want to make jokes of or make fun of. But when we carry men along with this, it makes it easier to say that this is a humanity problem. This is not a women problem. This is a human being problem, and we should come together and fight it together. So I commend it when I see a man and he's talking about breast cancer. I'm like, oh, wow, that's impressive. There should be more people like this, because men have certain type of relationship. Fathers have special relationship with their daughters in most cases. So these are things that a daughter should be able to tell the father. That, hey, I'm feeling this type of pain or this type of discomfort in my chest or my breast area. And the father doesn't say, go meet your mama. No, let's talk about it, because both male and female are equally important in us actually fighting cancer together. It's not a women fight against cancer. It's a humanity fight against cancer.
I like that last line, and if anything, I think that should stick with people. It's not a women fight against cancer, it's a humanity fight against cancer. We'll go on a short break now. It's still Fafanua Afrika. When we come back, the conversations around breast cancer continue as we celebrate Breast Cancer Month in October. Well, it's October and we're commemorating Breast Cancer Awareness Month. This is the month where we're not just wearing pink ribbons, but we're bringing to the fore the conversation about breast cancer and the dangers of late-stage diagnosis. This is where we let young people understand the dangers that are involved if you do not check yourself. And we also let those who are survivors or those who are going through it know that they are not alone, because it's not a one-person problem. Just as we established before the break, it's a societal issue, it's a men's problem, and this is the month where we bring the conversation to the fore. I still have amazing ladies with me who are championing this conversation. Temitope Okembe, cancer survivor and office administrator. Oluwatobiloba Oguntoyinbo, cancer patient advocate and co-founder, Saint Cancer Initiative. And we also have Gloria Orji-Nwajiogu, President CEO, Network of People Impacted by Cancer in Nigeria. Thank you so much, ladies, for still being here with us. Let me come to Temitope now. How would you say that young Africans are using social media or can use social media and digital platforms to drive awareness? Temitope, can you hear me? All right. Okay. Let me throw the question to Oluwatobiloba. While we wait for Temitope. Tobiloba, how do you say that? How do you think young Africans can use social media and digital platforms to drive awareness about breast cancer?
I would say that our generation is we are digital natives. We are interested in social media. We are interested in technology. Everyone wants to know about what's trending and all. But that, as much as we all look for trends, that can be used in a positive way. Because someone mentioned earlier during the interview, she said, oh, I think I can just do short videos and then put it on Instagram so that people can see. That's one way to do it. And that's like a great way to go about it. These days, everyone is on social media, both the young and the old. So we can start with creating short, relatable videos. It doesn't have to be with medical terminologies that people do not understand. Trying to simplify it as much as possible so that it's relatable and usable for people that are consuming such content. Some people are readers, so blogging is another form. Some people go to Google for everything. And as much as Google, we say, is not a safe space, there are still right information on there. So blogging is another part in which people can actually use to talk about cancer, breast cancer awareness, and talk about early signs, different types of treatments, type of testing to go for, and the like. So I would say social media, short videos, and relatable content, even as memes, and as well as blogging, because that's where people most time run to search for health information.
All right, thank you so much. Gloria, what role would you say that research and policy advocacy play in reshaping public understanding of breast cancer? All right, do we have Temitope now? Okay, Gloria, can you hear me?
Yes, I can hear you.
All right, so I was asking, what role do you think that research and policy advocacy play in reshaping public understanding?
I think in terms of policies, there's actually need for correct policies to be put in place. And because if they are in place, it will help. I am a big fan of prevention than cure. And so there should be policies that ensures that every female who is up to 40 years and above should have her mammogram once in a year. And for the females that are below 40, they should be able to go for their breast ultrasound at least once every year. And this should also, especially breast cancer, it should be taught in schools. It should form part of, these days there are no longer health clubs and all those things that used to exist. but it can be like, part of the school curriculum, because when you catch it young, you can even know how to prevent it. And while creating this awareness and making these policies, there are other things that goes with it, because you can even bring up the causative factors, the risk factors, so that people from when they are younger will be able to try to prevent having breast cancer in future. Yes, we know that breast cancer could be genetical, so it could be hereditary, and there's nothing you can do. But if it is even genetical and hereditary, you can always be on the lookout for it. And so that's it on the policies. But on the research is, I kind of have a big problem with research happening in Nigeria, because it's like we don't even want to be equipped to do that. Because I've seen a lot of researchers, the data they bring out are not the real thing. And these are one of the challenges we have, because our data does not really, it's not up to standard. And most of the times, that's why it is difficult for it to be accepted globally. But if we can really do the right thing, get core researchers to know that what you are doing is going to affect generations to come, then it is a laudable thing. I love research, and it's because of the lack of research that so many pharmacology companies are not in Nigeria. If we are doing real research, they wouldn't believe it. They would come here because the patients are here. The numbers of patients, you mentioned about 24,000 or 23,000 being diagnosed annually. So if we're talking about patients are here. And farmers love where patients are, because these are where they could, through research, try to find out, some medications and drugs that can fight or cure, heal, or even at least keep the cancer at bay. But it is not happening here because our research is not yet, okay, let me not just say all. Most of our research are not up to standard. And this we need to start thinking about in earnest. And I have to be honest with you, I believe so much in Nigeria. And I believe that if research could be done the way it's supposed to be, by now Nigeria's researchers would have been, find it halfway, if not, complete cure for cancer in Nigeria. That's what I believe.
All right, thank you so much, Gloria, for that. Oluwatobiloba, what policies and healthcare framework would you say are needed to make treatment more affordable and more accessible? It's not enough to diagnose early. People need to be able to afford and even access these treatments.
Yes, I would say that when it comes to cancer treatment, it varies, and it's not a one-size-fits-all kind of solution for every patient, just because every patient's situation differs from one to another. So for one, when it comes to policy, I do not think as of right now we have any health insurance policy that helps cancer patients out. The cost of cancer patients is a lot. For there to not be health insurance that would help out with that. And like Ms. Gloria said earlier, I shouldn't be knowing about breast cancer when I was 18. This affects us so much that it should be integrated into curriculum from early education stage. So when that happens, we are able to actually increase preventive measure, because the truth is breast cancer treatment isn't just only expensive in Nigeria or Africa. It's expensive everywhere. So if this is a world issue, then we should try and take advantage of preventive measures. And then just like Gloria said earlier about research, I think for one, even we as Nigerians are trying to build our trust back to research. We don't have a lot of research going on, and also where there are, people don't readily trust, because am I sure they are using my sample for the right thing just because of past experience? And this is not just Nigeria. This is as Black. Only 2% of Black are involved in clinical trials. Before paracetamol becomes accessible, some people need to be tried out on that. That means that there is a small number of people that will use the medication for a while before they can actually say, oh, let's start selling it to the market or to the general public. If people are more interested in joining the clinical trials that are ongoing in Nigeria and not the fear of, oh, I don't want to be the guinea pig, then we would make more progress with even us bringing out a solution to breast cancer. But I would say prevention and early detection is what we should really focus on as a growing country. Thank you.
All right, thank you so much. Let me still stay with you, Oluwatobiloba. In a few minutes, can you walk us through your experience? Maybe not the whole thing, but you know, like you said, you had no business, you know, being diagnosed at such a young age. How did that feel for you at the time?
I mean, at the time, I just noticed lump in my breast. That was why I was sure, like, oh, not all lumps are cancerous. And the next thing, oh, you're going to have to do a surgery and it will be removed. And I'm like, oh, okay, let's go for it. Because if you don't know about something, there's a high chance that you don't ask questions about it. And just because I don't know about tumor, I couldn't have asked any question. And it was until after the surgery, I started doing research on my own, of course, on Google, and I'm like, oh, okay, so there is benign tumor, there's malignant tumor. I wish I'd known this earlier. I would have asked this type of question. I would have stood up for myself to say, oh, this is, why not do this thing? And not just follow through with, oh, you do this, go for it, you know. And it was during that period, even though I didn't have cancer, I couldn't tell people just because I don't know how I'll be received. I don't want to go outside with no bra on, because people would see you and say, oh, why is this one dressing like this? Why are you wearing big clothes? That was my reality at that point. But if this is something that I knew about in secondary school, not when I was even as a university student, I had no idea until I had to undergo surgery. So if this information is readily available for me, there are some things that would have happened differently just because I would have been able to advocate for myself.
All right, thank you so much for that. Let me also ask Temitope that personal question. How was it for you at the time, you know, going through what you went through? Did you deal with any form of stigma? Definitely must have been difficult. What were the things that you wish you knew before that experience?
Well, in my case, was there stigma? Of course, like Toby said, I didn't know how I was going to be received, so I opted to fight quietly. And then, you know, first I had a lumpectomy as well. You know, when I first felt the lump, I went to the hospital. They wouldn't allow me to have a mammogram because I wasn't up to 40 at the time. So we opted for a regular scan. And then the scan came back and said it was benign. So the general surgeon was okay, it's nothing, you can just remove it. But upon removal, he had told me they were going to do some histology. I don't want to be throwing all those medical words out there now. They were supposed to run some tests to let me know. But for some reason, he never came back with the results. And of course, as a Nigerian woman, I didn't bother. Because he said, he gave me his word, like, if you find something, we'll definitely let you know. But in case, so I didn't even bother when I didn't hear from them. And lo and behold, six weeks after my lumpectomy, the lump came back, a regrowth. It was at that point I went back to the hospital, and by the time I would be done with all the biopsy, all the testing and everything, it was stage 3 breast cancer. You know, at that point, I didn't even know, I couldn't talk to anybody. I just wanted it to be over with. So in my case, stigma was a thing because, number one, like she said, like Toby said rightly, I don't know how people would receive it. And like Ms. Gloria said earlier, you know, a lot of myths around it, or maybe something she did, maybe, you know. So all of that were fighting for a space in my head. So because of that, I opted to fight, silently and quietly. So for me, I think also awareness is key. And like Toby said, early on information so that I know what I'm fighting, I know what I'm up against, and that way I'm able to advocate for myself better. That's it for me too.
All right, thank you so much for Temitope and Oluwatobiloba. I'm sure that was a vulnerable moment for you there, and I'm so glad that you both have scaled. I want to ask Gloria this question. We're fast running out of time, but very quickly, Gloria, beyond medical treatment, how can we strengthen emotional and psychological support for patients and for survivors?
Much for that question, because most of the times these are the area that people, even medical doctors, they ignore, and these are the area of cancer journey that is very important to the patient. The doctors are the worst communicators, unfortunately. Even sometimes when they write things, you won't even be able to understand it, and that doesn't only have to do with their write-ups. It also has to do with how they talk to patients. And unfortunately, they don't give the patients the news the way they're supposed to do that. And most of our oncology outfits don't have any psychological support. I think it is of late that some are doing some pocket things here and there with psychology.
Gloria, can you hear me? Okay, Oluwatobiloba, do you want to?
But
okay.
Most of the times, the doctor gives you this. Most of them, what is at the back of their mind is like, you have cancer and you're going to do mastectomy. You're going to remove the breast, and nobody gets you prepared for this. And then you just get it, and it hits you. And that is why some patients, when they get this news, they go back and they say they can't take it. But if there is a psychological support that will first of all walk you through and ask you questions like, do you want to hear this news alone, or do you need someone to be with you? Something that could make you prepare your mind to whatever is coming. We hardly, I think some hospitals have it, but they are so few. And these are the things I think we should be talking about. And another thing, it's not just talking about the treatments, the diagnosis. What about survivorship? A lot of cancer champions, they find it difficult getting back to the society that they have lost. And that, in fact, that is the worst stage, because initially they are even pitying you that, oh, you have cancer, you're going through treatment, you're going through chemo, but when they say you're done with treatment, everybody actually is done with you. And that is when, if you're not careful, depression sets in, because you're struggling to go back to your normal life, which doesn't happen. You're struggling to start making ends meet, which is very difficult, because subsequently you'll be going for periodic checkups, you'll be going for investigations, so it kind of drains you emotionally. And that is when so many cancer patients feel abandoned. And so all these things, especially the psychological support on survivorship, should be taken into consideration.
All right. Thank you so much for that. I think that this is a good place to wrap up the conversation. Thank you, Gloria. I want to say a big thank you to our guests for doing absolute justice to this conversation. Temitope Okembe, cancer survivor and office administrator. Thank you so much. Oluwatobiloba Oguntoyinbo, cancer patient advocate and co-founder, Synced Cancer Initiative. And also Gloria Orji-Nwajiogu, President and CEO, Network of People Impacted by Cancer in Nigeria. I appreciate your time with us, and we're hoping that more people are aware beyond the pink ribbons. People know what this entails, and take proactive measures and for those who are already battling it, people also know what to do to support them. Breast cancer does not have to be a death sentence. In Africa, the power of awareness, advocacy, and early detection can actually save lives. But it begins with breaking the silence. It begins with supporting the survivors and creating systems that care for people and not just the patients. The question, though, is, are we ready to change this narrative? Thank you so much to our amazing guests. And this has been Fafanua Afrika. Thank you for watching, and do well to stay tuned for our subsequent episodes as we bring you more issues and more challenges that the African youth are facing, and as we try to prefer solutions to them as well. Thanks for watching. I'm Blessings Mosugu.